going to try to cut costs any way they can, and you know, that's just the first. I mean, there's going to be a wave of companies deciding how many employees can we afford under these regulations. I mean, this is an enormous burden that they are going to bring down on our doctors, on our businesses, and on the health insurers, which the Obama administration looks to demonize, and I'm afraid that they're going to have a hard time staying in business.
Well, they're essentially going to be public utilities regulated by the government.
Exactly.
And I'll tell you, this is going to be a good deal for, as government employees, there's going to be 16,500 new jobs just in the Internal Revenue Service alone, whose task it will be to chase after you, everybody you know, to make sure that you have purchased government-approved health insurance policies. And if you have not, you are going to be fined, possibly imprisoned.
The IRS of A is like, that's how I like to call it what we have now. The expansion in the IRS is just stunning and really an underreported facet of this bill. People don't like the IRS already, and get ready for a lot more of them. Get ready for a lot more intrusion from them. They're going to scrutinize your finances. You're going to have more contact with the IRS than you've ever had under normal circumstances. And some people find that frightening. And it's not just the IRS, by the way. How many bureaucracies and counter bureaucracies and sub-bureaucracies are going to be created by this? You can't imagine.
We just got this email in from a listener, Ms. Madison. It says, Gordon, I very much enjoy your program and download it on a daily basis from iTunes onto my MP3 player in my car. Frankly, this also enables me to fast forward through many of the radio commercials, which is an added bonus. I am also a physician and have very little time to write such letters as this. I want to ask you to advise your listeners of the following matter. The doctors that Obama keeps trotting out are university types and researchers. The doctors who see patients, and which I have met, are almost universally opposed to what Obama and the Democrats are trying to do. This is in no small part why membership has fallen by so much in the American Medical Association. As is the case with most things, there is more here than meets the eye. Truly, the Democrats have pulled a fast one on the American people. Please withhold my name and practice. All he's willing to say is that he is a physician from Eugene, Oregon.
Yeah, and I think your listener hit it right on the head. Your average rank and file physicians, your frontline physicians, they are opposed to this bill. 63% in that Medica survey preferred that Congress start over, do incremental, smaller approaches to help bring down the cost, not this one size.
Yes, but that would be, quote, historic.
Yeah, well.
We couldn't come out with a great big gavel.
Yeah, God save us from men with big egos, right?
Actually, I think this one was a woman with big egos.
Her too.
Pelosi.
Yeah. But, you know, the president, look, the resurrection of this bill, of this agenda, after Scott Brown won in January, is truly astonishing. I mean, all the political winds were against this bill, and 3 straight elections, voted against this bill, basically. And the Democrats in Congress, the administration, they decided they were going to double down. They gambled their careers, their party, on this decision, and they have brought it over the finish line, apparently.
Well, I think, unfortunately, they may, from their perspective, they may have brought themselves to a finish in November.
I mean, that's a possibility, and certainly the polls suggest that, but I would hasten to add that that is not a guarantee. For one thing, a lot of the measures of this bill and a lot of the measures that would be unpopular will not start taking effect for 6 months, a year, some of the taxes and so forth. And in the meantime, some of the good things would start right away. For example, insurers not being able to deny you for pre-existing conditions and so forth. So between now and November, it's not clear to me that the impact, the negative impact in totality will be apparent to the average voter. You know, I'm not down.
Except that I think the taxes take effect promptly. The benefits not until about 4 years from now.
Most of the benefits kick in after 4 years, that's correct. Some of the taxes will be rolled out soon, but it'll take a 6 months to a year for those to really get rolling. I don't know if the full weight of this is going to be brought to bear on the voter before November. And it is possible that the administration will be successful in changing the topic to some degree. I would caution against betting that this is going to be a tsunami.
I have a lot of faith and confidence in the Tea Party people. They're all over the country. They're spontaneous, and they are very, very angry. All right, we're going to take a quick break, Mr. Patterson. My guest is Mr. Matt Patterson. He's the health policy analyst for the National Center for Public Policy Research. And we're going to take a little break. Then we're going to go to the telephone calls at 1-800-GG-LIDDY. That's 1-800-445-4339.